Black History Month is an annual celebration that honors the achievements and contributions of African Americans throughout history. It originated in 1926 as Negro History Week, founded by Carter G. Woodson, and has since evolved into a month-long celebration. The theme for Black History Month 2025 is African Americans and Labor, which highlights the profound impact of work and labor on the collective experience of Black people. This theme explores the various ways that work, both free and unfree, skilled and unskilled, vocational and voluntary, has intersected with Black history and culture. From the traditional agricultural labor of enslaved Africans to the debates among Black educators on the importance of vocational training, the theme of African Americans in labor sets out to celebrate the potent impact of Black people's work, as well as to acknowledge the challenges and struggles that Black workers have faced. Throughout Black History Month, people come together to reflect on the rich history and contributions of African Americans. It's a time to honor the achievements of Black leaders, artists, inventors, and everyone who has shaped the United States and the world. By exploring the theme of African Americans and labor, we can gain a deeper understanding of the complex and multifaceted experiences of Black people in America. It's an opportunity to celebrate the resilience, determination, and creativity of African Americans and to continue working towards a more equitable and just society. Now, before I pass the microphone to Pam to introduce our panelists today, I want to thank a number of people and units that made today's event possible, starting with Kylie from the School of Nursing, who introduced us to this amazing film, our panelists today, Brian and Tanya, Maria and Nyla from Marketing, Erin, Jason, and Connor from Communications, Jamie, Mackenzie, and Ellen from Development, our President David, Jill and Lori from the President's Office, and of course, Pam from the Center for Social Justice. Thank you so much for your amazing partnership and support. Pam?
Thank you, Daniel. Thank you, everybody, for being here today. It is my great honor to introduce you to our professional faculty that is joining us today to discuss the film. Dr. Tanya Boyd is a highly accomplished advanced practice nurse, nurse leader, and educator based in Boston, Massachusetts. She has a proven record of excellence in both in-person and online nursing education. Tanya specializes in curriculum development, innovative online teaching methodologies, and is dedicated to fostering collaborative and engaging learning environments. Currently, she serves as a faculty member and a course lead for Nurse 104 in the ADN program at Excelsior University. Her prior roles involved utilizing innovative teaching strategies, providing mentorship, and developing program curricula to meet the evolving needs of adult learners and the healthcare industry. Previously, Tanya contributed to Walter Kluwer's as a contracted contributor for Lippincott procedures, where she developed evidence-based content for advanced practice nursing procedures. She served as an Associate Chief Nursing Officer for Quality, Education, and Professional Development, leading nursing workforce operations at the field hospital during the COVID-19 pandemic and ensuring compliance with COVID-19 protocols. Tanya is board certified by the American Nurses Credentialing Center as a geriatric nurse practitioner since 1998. And has also held various positions in clinical and educational setting, demonstrating her commitment to improving quality, safety, patient satisfaction, and outcomes in healthcare. Tanya holds a Doctor of Nursing practice from Aspen University, a Master of Science in Nursing from the University of Massachusetts, and a Bachelor of Science in Nursing from Fitchburg State University. Thank you, Dr. Boyd, and welcome. Dr. Brian Purvis is a department chair at Excelsior University, where he focuses on curriculum development, student success, and advancing nursing education. With the extensive experience in clinical practice, academic leadership, and healthcare advocacy, he is committed to improving nursing education, workforce development, and patient outcome. At Excelsior, Dr. Purvis plays a key role in developing ADN and pre-licensure BSN programs, ensuring students are well prepared for the NCLEX success and clinical practice. His research interests include LPN to RN transitions, standardized testing in nursing education, and strategies to enhance student engagement in online learning. Beyond education, Dr. Purvis is a voice in healthcare equity and professional development, contributing to national nursing organizations and policy discussions on diversity, inclusion, and health disparity. Welcome, Dr. Purvis, and thank you for joining us today. Daniel?
Thank you, Pam, and we're so honored to have you, Brian and Tanya. And so let's get started with the questions, if that's okay. So let's start with the most general one. Could you both share your reactions to the Everybody's Work film? What were your main takeaways and why?
Well, I could take that question. First, I want to say I watched this film 3 or 4 times, multiple times. I'm pretty sure everyone else has. But the film was a powerful reflection of the systemic barriers that we see that exist in nursing, and healthcare in general, and in nursing education. It reinforced that we see racism in healthcare is not a perception, it's a reality, right? And it's going to affect our patient outcomes. My main takeaway was that representation is going to matter, right? Who provides the care is going to directly impact the quality of care. We need diversity in nursing to improve patient trust and adherence to treatment. And we, as nurses, must take an active role in confronting and challenging structural racism in both education and practice.
Yeah, thank you, Brian, for that. I echo your sentiments, and I just want to add too that nursing is more than just a profession. It's actually one of the most trusted professions, and with that comes a lot of responsibilities. And so, in that same vein, it's a calling. It takes a special person to be a nurse. It requires teamwork, it requires advocacy and deep compassion for the patients that we take care of. And I really feel like this film really reinforced that nurses do not work in isolation. We cannot. We collaborate with colleagues. That's what we're supposed to do. And, communities to provide holistic care with families. Families are part of the patient circle. We focus on patient-centered care, meaning every patient is not one size fits all. I just really feel that this movie really emphasized the role of equity and inclusivity in healthcare, and really urging us to look at the systemic barriers that impact both our patients and healthcare professionals.
Thank you both, and thank you for your leadership. For everyone's context, for the next questions, we're going to be sharing, for those of you who might not have watched the documentary or the film, or might have watched it a few days ago, as a reminder, we'll share just a little clip, and then we'll base the follow-up question on that. So Pam, thank you for helping us with that.
Sure. So just bear with me as I show the clip and then ask the question, just to make sure that we have context. So this question has to do with this part of the film. Okay. Sorry. There we go.
View, there are several shared nursing values that I espouse to and that I think are really important to highlight. The first one is autonomy. I mean, whether it's bodily autonomy, patient autonomy, family autonomy, community autonomy, people know what they need. And so nursing, another sort of shared value is we're in service to people, the public, communities, right? So it's really ascertaining what does the person or the people in front of you want and need, and how can you connect them to getting those needs met?
So my question is, what do you believe are key values of the field of nursing?
Ryan, do you want me to go?
Yeah, you can go ahead.
Okay, all right, thank you. So definitely compassion. You have to have compassion. You cannot be an effective nurse if you don't have compassion. Integrity, always doing the right thing, even if no one is watching. Very important key value in nursing. advocacy, I believe, is our strong suit, and it's advocacy for all of our patients, standing up for patients and their rights, especially those who are vulnerable. Collaboration, that's our responsibility. That's how we grow. That's how we learn. That's how we get to the best outcomes for our patients. And then I think lifelong learning, continuing to learn about history, learn about new things, innovations to help our patients, because at the end of the day, and as I always said to my students, it's not about us, it's about our patients.
And I echo those same values, and we look at compassion. We need to meet those patients where they are, right, without judgment. Advocacy, right? We have to speak up for our patients and address some of the healthcare disparities that we see. And then, like she said, integrity, making sure we're looking at, our ethical background and our evidence-based care. And then to expand upon that, cultural competency. We need to understand that our patients are going to be diverse, right? Coming from different backgrounds. And then we need to look at equity, right? Making sure like everyone's going to get fair and just treatment, regardless of, their financial status or their identity or their race. So these are going to be some of the key values for the field of nursing.
Thank you. So Pam, could you share the clip on the impact of the nursing field?
Sure. Go right to it. Oh. Okay, there we go.
People address us and say, haven't you done enough work? Haven't we come far enough? It's life or death. That's why we do this. When we're at the bedside, as patients, as loved ones, when we see the differences in care, when we see that who takes care of our parents or who takes care of our loved one impacts whether they live or die, that's why we do this. It's life or death.
Thank you, Pam. So, in your experience, do you agree, and why? Right? And if so, what does that mean? What is the impact of nursing and the nursing field?
Yeah, I can take this one here. I would say, yes, I think nursing is life or death, right? Not just in critical care, but in every patient interaction. We got to look at who provides care is going to determine our outcomes in nursing. We know right now we look at crises such as we see Black women have higher maternal mortality rates, and that could be due to provider biases. We could also look at pain treatment disparities for persons of color. Representation in nursing, right, is going to affect our trust and adherence to treatment. So we got to understand that nursing saves lives, but disparities and healthcare disparities can cost the patients their lives, which again is going to be a life or death situation.
Definitely, Brian, agree with what you said. We are the difference between life and death. The way that we provide care, whether it's timely medication administration, proper monitoring, or emotional support, it really directs patient outcomes. I've certainly witnessed incidents over the years of nurses being very vigilant in advocating for patients who might have a history of, say, substance abuse and are labeled as drug seekers and are not often afforded the same type of pain control management that someone who doesn't have that history. So in that vein, I feel that as advocates, we protect those patients who are stigmatized to a sense and advocate for them so that they don't have poor outcomes from inadequate pain control. We definitely have to stay highly skilled and committed and compassionate to patient safety and outcomes. That is my mantra as a nurse.
Well, thank you for your insight, Pam. Would you like to go to the next question?
Sure. What I'll do is I'll just say the quote this time rather than going to the film. just because it's a little bit quicker and we can have a conversation about this next quote from the film. It says, "The culture is our prevention. If we can bring their culture into healthcare, that is going to be our prevention." So from your perspective, what role does culture play in healthcare and nursing? And why can't, just to play devil's advocate, why can't we just treat people?
I definitely like to comment, Sonia Frazier, she was one of the nurses, Indigenous nurse in the film. Also, I think she's the president of the Oklahoma Nurses Association. And I really like what she said, that it's important that we know the history of our patients. We have to bring culture into healthcare. I'm just paraphrasing what she said. That is our prevention, by understanding where people come from, how they act or react in their communities, what supports them, what makes them, spiritually feel supported. Like, those are things we need to understand to help prevent bad outcomes for our patients. And so I think it's very important to understand our culture and bring it into our practice.
Yes, and
Thank you.
in alignment with Dr. Boyd's comment there, I think we got to look at culture, right? It's going to shape how our patients are going to experience the healthcare system, right? How they're going to engage with healthcare. We know that if we don't provide that culturally competent care, our patients are not going to have that trust, right? We know culturally competent care is going to improve their trust, their communication, and their adherence to treatment plans. There's too many times in healthcare that we see, again, if we ignore culture, what's going to happen? Well, we're going to see mistrust, right? Misdiagnosis in that system and for those patients. So we need to practice cultural humility, right? We need to learn about our patients, right? What's their beliefs? What's their values? What's their traditions? We need to understand that there's going to be language barriers and health literacy challenges. And we need to personalize that care, right? We can't put everyone in a one-size-fits-all box, right? We need to make sure it's a personalized care. And again, culture is going to play a huge role in healthcare and nursing.
Thank you. That's so pivotal, I believe. And not only for the nursing field, right? For our interactions in general. Something interesting that has always been interesting to me about the healthcare field is how important the interaction between the service provider and the patient is. Without information from the patient, it's very difficult for a healthcare provider to respond effectively, right? There's this reciprocity and requirement to interact. And as you were saying, it's not just information, it's also values. It's also beliefs. And that should inform, right, how to provide the best care. Thank you for those responses. Here's another quote that I really appreciated in the film. "Nursing has always been aligned with social justice. Its purpose has always been about advancing the dignity and human rights of individuals in the context of health." That really struck me as an important quote of the film. Do you agree? If so, why? And from your perspective, how do nursing and social justice intersect?
Well, I can take this one here. I think, yes, right. We're going to say, from my perspective, I think historically nursing's been at that forefront of social justice, right? As a nurse, we have always fought for patient rights, right? Equal health care, systemic change. And we look at things like the civil rights movement, right? We fought for desegregation in hospitals. We look at, our fight for maternal health disparities, right? Discrimination, access to care, not just for, people of color, but for marginalized communities. So when we look at social justice and nursing, we cannot consider them separate because we're always fighting for equal, fair treatment, access to care as our duty as nurses.
Yeah, Brian, thank you for that. To build upon that, even going further, before the civil rights movement, I think about the women's movement and how Black women in particular played a big role in the women's movement. But we were in the background. We weren't allowed to march during those parades and protests that were had. So, as a Black woman, I understand like where my history comes from and whose shoulders I stand on very proudly. And so, to your point, we as nurses, particularly nurses of color, I feel strong advocates for health equity, access to care, and fair treatment. for all patients, regardless of what they look like, where they come from, and racial disparities in healthcare, lack of access to preventative care. All of those things are very important and relevant to the social justice movement, even more so today as we are living through unprecedented times.
Thank you. Pam?
Thank you, Doc. Yes, sure. So one of the things I found so interesting about the film, and I agree with Brian, I've watched the film several times as well, as some of us have, and it's a holistic approach to looking at a healthcare system from beginning to end, focusing on nursing, right? And on numbers and on data and on facts that the system sees, that the profession sees. But one of the things that I loved about what they said when it comes to education is that this is community work. So we can't do this work in isolation. We can't, from what I gathered, that we can't do this work in isolation. And so it is as well with our work when it comes to diversity, equity, inclusion, and making everyone feel that they belong. It is community work. And one of the things that struck out to me is when one of the professors, the doctor said, you can't do this because you can't by yourself, because you can't see the scripts that you internalize for yourself. How do you constantly stay on top of learning and community, and what does really community mean in patient healthcare from the perspective of a nurse? Am I frozen?
You're not frozen.
Go ahead, I'll let
Okay.
Dr. Boyd, go ahead, you can take.
What's the last part of the, it seemed like it broke up a little bit, the last part of the question. I know it was about.
So, oh, okay,
community.
I apologize. I just
that's
said from
okay.
the perspective of a nurse,
Mhm.
what does community mean in patient healthcare?
I may have mentioned it earlier. It means teamwork and collaboration, which sounds so cliche, but it's finding those partners, it's finding those allies. You don't have to look alike, you don't have to come from the same background, but you're there for the same reason, and that is our patients. And so I think that to me is what's important about community, is finding those allies at work to help push forward things that are important to patients to help improve their outcomes. So I would say that is, for me personally, how I've operated and moved as a nurse over the several decades have.
Yeah, and I think, when we look at the community, right, from a nursing standpoint, right, we're looking at that social component, right, that cultural and that environmental component. From a nursing standpoint, right, we're looking at patients and their access to healthcare, right? What's their social support? What's those social determinants of health, right? Is there any cultural issues, right? Like that whole community system. So I think it's going to be impacted on those three levels where we look at that social component, that cultural component, and those environmental factors. And that's going to, again, that's what community means to me. And just making sure like we're looking at that support and those resources and those relationships like Dr. Boyd described.
Thank you. Thank you, Brian. Thank you, Dr. Boyd.
Another emphasis of the film was on inclusion and how inclusion intersects with or is part of the nursing work. The quote that I highlighted in this regard from the film is inclusion work is everybody's responsibility. How do you work with other people on differences is fundamental to nursing education and practice. Could you share your perspective on the importance of inclusion in nursing work and in nursing education?
Yeah, I'll take this one. I think inclusion is going to, be important because we need to include everyone. We need to have everyone at the table, and it's going to strengthen our profession, right? We know that diverse teams are going to improve patient outcomes, right? So the more diversity we have on our team, the better our outcomes going to be. We know we need to look at real world situations for our education, right? We need our students to be prepared to work with those diverse populations. And again, we're going to see challenges, right? So we need to have, diverse faculty, right? And leadership. We know we need to confront some of those systemic barriers, right? That is going to affect some of our students who may be either marginalized or minority students. And again, how do we get to a point where we look at inclusion? Well, we should, look at bias training, right? Mentorship, leadership pathways, especially for those who are underrepresented, so that we're including everyone at the table.
Yeah, thank you for that, Brian. Inclusion is critical in nursing. It ensures that all patients receive respectful, unbiased, and equitable care. Again, patient outcomes, that is our end goal always. We want patients to have good outcomes. It also fosters stronger teamwork and collaboration. It helps to reduce health disparities. And it also addresses those systemic healthcare inequalities in a more effective way when we are more inclusive. And as Brian said, evidence has shown time and time again that diverse teams produce better outcomes, whether it be financial outcomes for an organization, outcomes for patients in healthcare. We definitely need to do a better job with hiring diverse faculty. I think Excelsior is, I'm impressed with what I've seen so far with the faculty in nursing. And so, I thank the leadership for that. We have great student support services in our curriculum. We need to really develop curriculum that's focused on what inclusivity means. So I think that those are some of the things that resonate with me as far as what inclusion is to nursing.
Thank you.
Okay, thank you. So I am actually going to show one more clip for this next question. And please feel free to tell me if you want me to show any more.
It could be that the institution doesn't have the resources to support the student. It could be that the institution doesn't provide the faculty development that's needed for faculty to be able to teach to a wide array of students. We don't have those conversations.
So my next question is related to you as faculty members. In your perspective, what opportunities should nursing schools pursue to further support the success of their students?
Well, again, this kind of resonated with me, right, on my journey to, to where I am today. But I mean, nursing schools first have to recognize that systemic barriers are going to exist, right? We cannot blame students who are struggling because, again, there's going to be things that, they may be going through. I think we need to improve on certain things. We need to, like Dr. Boyd said, we need diverse faculty, right? So mentorship, representation. And when you watch that video, one of those students says, she was the only person of color in that school. We also need to create safe spaces where they can, report discrimination without retaliation. We need to expand academic support, right, so that they can overcome some challenges. Again, they're going to have different challenges. Today maybe look different, right? We may be dealing with someone who's in a tough situation. So we need to make sure we got support for those students. And then, financial aid, right? Again, they can't afford school. We always think of it as a luxury, but maybe they're paying out of pocket and they can't afford. So we need to make sure that, we can, increase financial aid to some degree to support those first generation and underrepresented students. So I think that's how we can further support our students' success.
Yeah, definitely. I agree, Brian. I think too, being a Black woman and a professional nurse, for over 40 years, I think about my journey, how it started in high school. And I remember my guidance counselor, her name was Miss Bushy. I'll never forget her because she tried to steer me to an LPN program. And my best friend in high school, her name was Beth. She was white. She wanted to be a nurse too, and she steered her to an RN program. And I remember how that felt. And I said, wow, why, and I was an honor roll student. And so, luckily my parents, they were very supportive, and neither went to college. And so they insisted I go to a 4-year bachelor's degree program, which, you know, I'm so happy that I did. And I kept going, and I didn't stop. I just got my doctorate a couple years ago, and when I was 62 years old. So, you know, I didn't let anything stop me, you know, and I think that when students see me, and students have expressed this to me, that they're so happy that they have me as their instructor. And I don't know that it's only because of the color of my skin, but I think a lot of students of color I understand some of their experiences that they've gone through. And it's unspoken, but I understand. And so it's really just important that we have, again, faculty, diverse faculty, so that students feel seen and they see what they can be. So I think that I'm sticking with that. That is, yes.
And I want to say, I definitely, you know, to follow up that point, I definitely agree. I mean, you know, I was one that came from CNA up through LPN, right? Like I couldn't go to the 4-year university, right? Didn't have enough money and, you know, enough time, right? Like, so I had to climb all the way up the ladder, right? Like it wasn't like I could just go into a 4-year program. I had to work my way up every single ladder all the way to where I am today. So I kind of echoed kind of the same thing in that same path. So just kind of understanding where those students are at, right? Like the journey that they may be on, maybe similar to mine, and being a male coming into you know, into a profession like this, right? That's another kind of barrier. But again, just overcoming those barriers and, you know, kind of being that example for students that we see today.
That is wonderful. Let me also refer to a portion of the film that focused on the intersection between nursing and spirituality. I thought that was a very interesting part of the film. And I'm curious because the times when I have needed healthcare or when a loved one needed healthcare, the vulnerability, the concern, the seeming lack of power on anything, right? Like it's overwhelming. And it's usually a time when we recur to spirituality to understand the experience and to be able to survive it. And a constant has been the nurses that are around one, you know, how important those nurses become to our lives right there and then, or to the lives of our loved ones, and how much we depend on. So just wanted to ask, what is your perspective on that intersection between spirituality and nursing? If you would like to share your thoughts or your insight in that regard.
Yeah, I think, you know, spirituality and nursing is going to play a key role, right? And nursing, we talk a lot about holistic patient-centered care, where we got to look at those patients' beliefs, their values, right, their sense of purpose. But again, you know, it's going to intersect a lot because we talk about that spirituality in nursing. We talk about our ethics, right? We talk about cultural competency. We talk about end-of-life care, right? Like it's going to come into play, our compassion. And it's going to be important because, again, it's going to, if we, you know, if a patient, you know, wants to bring spirituality to the table, it's going to enhance their satisfaction, right? It's going to help them to heal and cope. It's going to strengthen our relationship, you know, again, and it's going to help us listen to that patient. So I think it's going to be a great intersection between nursing and spirituality.
Yeah, I definitely agree. It is a great intersection. It is part of nursing, the spirituality piece. It's not religion, you know. I'm not interested in, you know, in that same way as spirituality. I know that me personally, you know, I grew up with, you know, both my parents from South Carolina. They are very spiritual people. They have beliefs, you know, outside of themselves that I know that they feel have sustained them and have helped them. And many of our patients have felt that way. And I support that 100%. You know, personally, I'm a spiritual person too. I definitely believe a lot of things that I've gotten through as a nurse and a nurse of color over years is because of my spiritual beliefs and strengths. So I think it's important, as Brian said, to providing holistic care is understanding that our patients are not just physical beings, they're emotional and spiritual beings. And we need to recognize that.
Thank you. Thank you for that, Dr. Boyd. And I have to congratulate you on continuing right with the doctorate, because I think some people think that when we turn a certain age, we turn the corner and we have to be put out to pasture to kind of retire. But what is retirement? I think that's wonderful. So I'll ask this question from the audience. How do we educate faculty on how to recognize and manage microaggressions in curriculum and discussions in the classroom and clinical?
Well, I definitely think that we've gotten better. I've been impressed with some of the textbooks I've seen over the past, years, that they are actually showing brown skinned people and dark skinned people. When I was going to nursing school, it was always a thing. Make sure the patient's skin is warm and pink and dry. I'm like, well, a lot of the patients that I take care of don't have pink skin, and so I think we're catching up. We have a long way to go. I don't know if anyone follows Dr. Joel Purvel. I don't know if he's a medical student, but he's on Instagram often, and he talks about the sort of like disparities and even the way that we monitor labs in certain patients, like renal function. That we have patients of color who are missing out on kidney transplants because of this formula that's not really made, for us to see that we are eligible to receive kidney transplants. That's bias in medicine is really what I'm getting at. And so I think that, I think that those are just some of the things that I can think of off the top of my head. Brian, I don't know if you have anything else to add to that.
Yeah, so again, when we look at, microaggressions, I mean, there could be many different types of microaggressions, right, that we can see. Someone, you're so articulate, or, assuming someone, and that happened to me many times, someone comes in the room, you go in there as a nurse and they say, well, the doctor says, hey, you're just a tech, right? You're the tech. Can you help me out here, right? Like, and you're really the RN. But again, we got to look at these microaggressions and how to manage them. Well, I think one is we need to be self-aware, right? Like, we need to recognize, our personal bias. We need to speak up. And anyone that's affected, we need to support these individuals, right? And then we need that cultural competency training just to make sure everyone is included. And then, we need to develop policies around it. So, like, different trainings just to make sure we're addressing some of these microaggressions that we see.
And I just want to add to that too, Brian, with the microaggressions, because they are very tiring. They're exhausting. They're something that you deal with not only with your job that you're hired to do, but microaggressions are another component, unfortunately, that, personally I've dealt with over the years. And so they're tiring. I think having allies recognize those microaggressions and to speak up when they see them and not be complicit in letting them go on. I think that those are very important things. Again, getting back to allyship with this work is very important.
Yeah, and I couldn't agree more, because I think when you look at those microaggressions, you're going to see, like, it's going to, erode, the trust, right? Like, it's going to impact that quality of care that we provide. And it's going to, reinforce some of those systemic biases that we talked about, right? Like, and again, we want to be more inclusive and respectful. We want equal healthcare. So we need to address these microaggressions.
Brian, you brought up before the wonderful truth about the fact that there are less men in nursing than there are women in nursing, which is, the reverse usually of some of the things that we see. But in that vein, I think that how does that affect or dictate your work as you do it? I got to imagine that when our society, is harder on men and less, they can't be emotional, they can't be, they can't cry, they can't express pain, right? For the most part, I know that we're changing slowly, but men have it harder in that respect. And as Daniel said, you are in a very vulnerable position when you're in a place of care. Somebody's caring for you. So I got to imagine that in your experience, what has it been like for men to see you walk through that door and, you know, sharing themselves with you in that way? Can you talk a little bit about that?
Yeah, so I could tell you, I've been on this journey for a long time of nursing since 17 years old. So I had a couple different things, right? So, being a black male, right, inner city, right, young, right, and coming into a predominantly, women, dominated field, I think there was a lot of, a lot of biases that you're going to see, right? Because this is a female profession, right? A lot of times I have people tell me, you're the doctor, right? You're not, what does it mean to be a nurse, right? Like you're a doctor, right? You can't be a nurse. You got other things that you're going to face, right? Like you got some patients that won't take the care of a male. I can remember going back to my nurse practitioner, right? I study, and then they'll say to you, like, you're a male, I don't want you to take care of me, right? And again, I think where this gets a little bit, kind of sticky is because, again, you don't have mentors, right? Like if you don't have someone to kind of steer you that right way and tell you how to navigate this, then it kind of hurts you a little bit. But I think, really what we have to do, right? We need to actively, right, have diversity, right? Not just, of people of color. We also need diversity in the male ranks in nursing, right? We need to recruit more men. We need to mentor more men into nursing. We need to make sure like we have men in leadership roles, right? Like we've seen Ernest Grant, right? He was the president of the American Nurses Association, right? Like in that video that we've seen. So I think, this is going to help, right? When we can kind of shift this cultural perception and kind of break down some of those barriers to make sure men are included in nursing and at the table. So for me, it's been a rough journey, but again, I get a lot of students that come to me and say, wow, you did it. How did you do it? Right? Like kind of mentoring them. The mentors that I didn't have, I can be those mentors for those students as they go along in their program.
Oh, that's wonderful. Thank you.
Audience, this is a time for you to ask questions. I have questions. I think Pam and I will not run out of those because we're really engaged in this conversation, but we want you to have the opportunity to do so as well. So if you think of one, please post it in the question and answer space so that we can ask it to our panelists. So a question that I have is some time ago, I read a book called An American Sickness. I don't know if you've by Elizabeth Rosenfeld. And it was very informative to me as someone who hasn't studied healthcare and I'm not in that field. But something that really struck me is that 2.5 chapters of the book were devoted to how to be a good advocate of one's health. And I thought it was sad that it felt necessary to tell the reader, right, how to advocate for themselves because of the potential gaps in the system or the potential gaps in support and services and response to their needs. And I'm wondering from your perspective as educators and also as people in the nursing field, what role does advocacy play? Why is it important? How should it be done? How should we respond to it?
Wow. Do you have another hour? It definitely is one of the cornerstones of the nursing profession is advocacy. We are the eyes and ears for the patients, and oftentimes are that sort of like conduit between the providers, the physicians, to communicate information that the patients might not want to communicate or might be afraid to, or might not want to argue with the doctor. Certainly as a geriatric nurse practitioner, the population that I care for are very much in the mindset that, well, the doctor said so, and so I better do it. And so, breaking down those barriers and teaching them that, no, this is for you, speak up, ask questions, ask as many questions as you want. I encourage all of my patients, write down a list of questions that you have when you go to see your specialist, write them all down and don't leave until you get them answered. Because that's your right. And so as nurses, we have to teach our patients to advocate for themselves. But before we can do that, we have to understand what it is. What are their goals of care? What is it that they want? Is there trauma in their background? And most of the time there is trauma. Our patients have experienced some type of trauma, especially patients of color. And so understanding, are they not taking their medications because of some trauma they experienced, not calling them non-compliant. So I think it's education on us as nurses to teach our patients how to advocate for themselves and to speak up for themselves.
Yeah, I agree. I think, just, that self-advocacy is going to be, definitely important because it's going to keep our patients well informed, right? So that they're making informed decisions, that their voice is heard. But, just like Dr. Boyd said here, is that we look at the medical system, right? It's paternalistic, right? Again, the doctor says do this, this, and this, and, you can't speak up for yourself. So we need to educate our patients. We need to let them know, right? Like they have to know that they have rights, right? It's supposed to be a shared decision maker, right? Like you're going to share in the decision making with the healthcare team. And again, we want them to advocate because we know, like, if they advocate, right, and they speak up for certain things, we know, one, it's going to help improve our patient outcomes. Two, it's going to help reduce any errors that we may see. And we know errors are common in medicine. It's going to increase their confidence, right? Like, and we're going to have their values, right, in their care. We want their care to be personalized. It can't be this cookie cutter, medical system or healthcare system. We need to make sure, like, we're personalized. So we need them to be informed, proactive, and persistent so that they're, and that they're advocating for themselves in the right way. So we need them to be strong advocates. So we have to educate our patients and train them and teach them to be that strong advocate that they need. And then we need to also advocate for them also.
Thank you for that. I really appreciate your response. I have a follow-up question, if that's okay. So you spoke, Tanya, about trauma, and I think that that's such an important. I don't know that was addressed in the film, but I think that that's such an important subject to look into, because just as we talked about the importance of culture and values and beliefs, right? And just how we talked about the importance of engaging everyone that's connected to the patient and working with patients holistically. It is so important to understand whether physical or emotional trauma that patients might come with, right, that has to determine a number of the approaches and interventions. At least has to influence how the healthcare response takes place. And I was just at I had the opportunity to participate in a conference on Friday. It was a New York State Black, Puerto Rican, Asian, and Latino Legislators Association conference. And I went to a presentation that focused substantially on trauma. And the presenter, powerful presenter, was saying the problem with trauma is that it is not the trauma itself, the action, right, that was traumatizing. What is the issue? The issue is how we respond to that trauma and everything that we carry with us to try to survive that trauma, sometimes for life, depending on the depth of the trauma. And our support of community members cannot ignore that, and because otherwise we'll be tangential to the need. So can you talk a little bit about how do nurses, right, and how do we prepare nurses to be responsive to trauma, to be inquisitive of that trauma, to be observant of that trauma, so that the response is as accurate and effective as possible? What do we need to do as educational institutions to prepare our students to be ready for that? And any thoughts in this regard?
Yeah, I definitely think so. I had the opportunity to work at an organization years ago where the population were patients with significant behavioral health issues. And, there was a lot that came with that. There was this non-compliance label or angry label, or they, were always mad, wanted to argue. Some of the things that I learned was that when people are angry or agitated or just like escalated, sometimes they just listen to them, like let them talk. Sometimes that's as simple as that. Or instead of asking someone, well, why aren't you taking your medication? You need to take it because of, X, Y, and Z, and saying, what happened to you? Is there something in your past that, might be contributing to you not wanting to take your medication? I think as nurses, it's not built into our sort of like health assessments in that way. So I feel like there's opportunity to build in trauma-informed care language in our assessments of patients. I think that would be great. I think that would bring us back to looking at the patient from a holistic point of view instead of this cookie cutter again, that you have to take all your medications or else. So I think that we have a better opportunity to make that happen as nurses who are aware that trauma plays a huge role in how our patients respond to the care that they receive in their outcomes. So that would be a recommendation on my end.
Thank you.
And just to follow up here, I think when we look at that trauma, we have to also look at some of those social determinants of health, right? So those non-medical factors that's going to influence our health outcomes. So we know as nurses, right, we need to train our students, right, like to look at, the social, we call it the SDHs, right, those social determinants of health, right? We need to look at those social, those economic, so environmental factors, right? What's the person's education? Do they have healthcare access? What's their neighborhood, right? Look like, then we need to look at that link between, trauma and those SDHs, right? When we look at, do they have any barriers to healthcare? Is there any discrimination that they're facing? What's their financial stress? And then, how is it affecting our patients, right? Like we need to teach our students to look at that because we know, again, if we want to address that trauma, we're going to have to look at some of those social determinants, right? Like to build that trust. We're going to have to, that trauma-informed care that Dr. Boyd described, screening for some of those social determinants of health, looking at different, policies, right? Because again, it's going to be a broader issue at play here. We have to break that trauma. Back in September, I was in a global advocacy group and we went over a lot of the social determinants of health. You would think that trauma was just only in our community, right? And I was in a group of, 15 people and, we talked nationally, all nurses. And one of the things we kind of honed in on was if we look at each of our communities, we could all agree that mental health is a big crisis in every community. And we did a show of hands and probably everyone raised their hand. Mostly, I think everyone raised their hand saying that mental health was a big impact, right? Like from trauma. Everyone was saying like, think about the shooting that we seen in Albany or the shooting in this community or these different things. So we know that's definitely a big issue and we need to look at those SDHs to kind of break some of that, cycle that we're seeing with that trauma so that we're promoting resilience and advocating for that equal healthcare access and equity for our community members.
Thank you both. That's very thoughtful. We're running out of time. So let me close with a quote and ask you both if you could share your final thoughts. And then Pammy, you have also something to add, and then I'll close. But and the quote I thought was really powerful in terms of how to understand the shared responsibility that we have for healthcare, nursing, and nursing education. The quote is, "This work is lifelong. It is ongoing. It needs to be done in community. It is not sustainable to do it alone." So, closing thoughts.
So I would say like my thoughts is as a nursing profession, as nursing educators, but we got to continue to fight, right? We got to continue to fight for equity, representation, and the treatment for everyone, not just one marginalized side, for everyone to be included. Again, we got to know, like, nurses have a responsibility, and as educators have a responsibility to uphold justice and fight disparities. And again, if we're looking at this from a healthcare side, we want to serve everyone equitably, right? And we got to lead that charge, right? We want to be that leader that we want to see. So, that's where I would leave my closing thoughts at for today.
Thank you, Brian.
Thank you for that, Brian. I definitely think that we should all want to be the change, that we should all want to see better for our patients, our communities that we serve, and for ourselves as a profession. Because again, we're seen as the most trusted profession. So let's really truly live up to that, and do right by our patients, the communities, our students, our colleagues, and again, just be the change that's needed in nursing to sustain our title as the most trusted profession.
Thank you. Pam, before we close, would you like to add something?
No, I'd like to thank Brian and Tanya for their time and for being here and for their expertise and sharing their personal journeys to this wonderful profession that is so very greatly needed. And as Tanya said, absolutely the most trusted profession. So thank you.
Yeah, and thank you for celebrating with us Black History Month. It is such an important event for Excelsior University, and it is such an important celebration for us to have as a community. And your participation made it come to life. So thank you so much for your wisdom, for spending this time with us. Thank you, everyone who joined us, whether for the screening or for the fire chat conversation. Let's keep the conversation going because this is an important one for Excelsior and for our community. Happy Black History Month, and let's adjourn.